Hey everybody, my name is Cody. I'm a registered physiotherapist and I practice out of Toronto, Ontario, Canada. In this video today, I'm going to tell you guys the quickest way to get rid of your jaw pain. It's something you can do on yourself at home. Before I show you guys this awesome tip, please hit the like button for the YouTube algorithm. Now in this video, I'm going to show you guys two things. The first thing is going to be a technique you can use on yourself to get rid of the actual jaw pain you have. And the second thing I'm going to show you guys is an exercise you can do to help correct the dysfunction in your jaw, which is causing the jaw pain. First things first, what is jaw pain? So when we think about our jaw, we typically think about this region in here. But where's our jaw joint? Another name for the jaw joint is the Temporomandibular Joint, or the TMJ. And an easy way to find it is if you find this little flap on your ear, you come forward about an inch, you put your finger right here. If you open and close your mouth, you should feel the bones moving underneath your finger. And I can feel it right there. That is the TMJ, or the jaw joint. So with jaw pain, we can feel the pain right at the joint here. We can feel the pain radiate down anywhere along it to here. And another common thing is getting a headache. So what causes jaw pain, and when do we commonly get jaw pain? Well, some of the triggering factors are chewing steak, chewing an apple, uncut, chewing bubble gum, and sometimes people get it when they wake up in the morning if they grind their teeth while they sleep. Before I show everyone the technique to help reduce their jaw pain, let's talk about some changes you can make in your daily lives to reduce your jaw pain. The first thing revolves around what we eat and how we eat it. Steak is very hard on our jaw, so we want to limit the amount of steak we eat. Or if steak is very dear to our heart, like it is for myself, we want to make sure we cut it into as small pieces as we can. Number two, apples. If we like eating apples, rather than eating a whole apple, try to cut it up. The smaller pieces of the apple will be much easier on our jaw. Third thing is bubble gum. If we like to chew gum, and a lot of us do because we like to have nice fresh breath, try a mint instead. Gum, we chew for minutes, even hours. It's just repetitive motion on our jaw, and it can lead to a lot of jaw pain. If you need gum, try to chew it for only a few minutes. Now, for those of you who wake up in the morning with jaw pain and who grind your teeth at night, it's very important that you get a mouth guard from your dentist to wear while you sleep. Grinding one's teeth throughout the night can last minutes or even hours, and it puts a lot of strain on our jaw and contributes to a lot of jaw pain that people experience. Okay, now to the part everyone's been waiting for. What is the best technique you can use on yourself at home to get rid of that nagging jaw pain? We're going to break this down into steps. The first step is finding the jaw joint. To recap, you find this flap on your ear, you move forward about an inch, and you just open close your mouth. And you can feel the joint moving underneath your fingers. So what you're going to do is you're going to use two fingers right on that joint line, right? Confirm you're on it. What you're going to do is you're going to push as hard as you can tolerate, and while keeping the pressure on, you're going to open your mouth all the way, and then you're going to repeat. So I'm going to demonstrate here. Find my joint. I'm going to push as hard as I can tolerate. I'm going to open my jaw. If you have jaw pain, this is going to be very painful, but that's good. We're working out all the knots, all the cobwebs in the joint and the surrounding muscles, which will give pain relief. Again, you might have to move around maybe a centimeter or two in any direction just to find that sweet spot that's really sore. So we're going to go again, find it, push down really hard, and open your jaw. We're not going to keep all that pressure pushed down when we're closing our jaw, just on opening. Whether you have pain in one side of your jaw or the other, we're still going to do both sides together. Now to start, we're going to break this down into steps. The first step is finding the joint. So we've done this already. Let's recap. You're going to find this flap on our ear. We're going to move forward about an inch. We're going to open and close our mouth. And we're going to feel the bones move under our finger. That's how we know we're on the joint. We're going to do both sides. So we're going to come the other side. Feel that flap. Come forward an inch. Open and close, feel that bones move underneath your finger, we're on the joint. Okay, now with our fingers on our left side and our right side, we're gonna push down as hard as we can tolerate, and we're gonna try to open our mouth. And stop. The key is to make sure you open your mouth all the way. Make sure you go all the way through the motion. Key points to focus on: you're pushing as hard as you can with your fingers. You're opening your mouth. It doesn't matter how fast you open. Okay, you're not going to be able to open very fast anyways because it's very painful. And you want to make sure you open your mouth as far as you can. We're going to do this 10 times. If where you're pushing doesn't really feel that sore, you can move around a little. So rather than being right here, you can move maybe a centimeter down. You can move a little bit forward, a little bit back. You're going to find a sweet spot, a spot that's really tender, really sore. It's good to push on these sore spots because these are the areas that need to be relieved. All the tension in the area needs to be relieved in order to get rid of that jaw pain. Parameters for this technique is you're going to do it every day. You can do it anytime you want, but you want to make sure you do 10 reps. You're going to do it for 1 whole week. Now, the cool thing about this is you're going to get immediate pain relief the first time you do it. And then after day 4, 5, 6, 7, you're going to notice on a day-to-day basis that pain just steadily decreases. And you're going to notice it's not there so frequently. The duration of my pain throughout the day is not there so much. Now, what's causing our joint pain in our jaw is known as a dysfunction. So our jaw joint is not working properly or efficiently. We have tight muscles around the joint itself is not happy. So by the technique that we're using, we're helping loosening everything up to relieve the pain. But the second thing we have to do is we have to retrain our joint. If it's a joint dysfunction, so our joint's not working properly, we have to retrain it in order to prevent this pain from ever coming back. Which takes me to part 2 of this video. And that is an exercise I want you guys to do at home, which is going to retrain your jaw to get rid of that pain for good. Now, the exercise is very simple. You're going to do it after you brush your teeth in the morning and before bed. After you brush your teeth and you're looking in the mirror, what I want you to do is I want you to do a big smile. And I want you to see the line between your 2 front teeth on the top and the bottom. They should be lined up. Now, the exercise is you're going to open your mouth very slow and all the way, and then you're going to close your mouth very slow and all the way. And while you do it, the first rep or first time we do it, we want to see if there's any movement in our jaw. For example, I'm going to demonstrate a proper function of the jaw. And if you follow along with the lines in the front of my teeth, you will know that they stay straight. There is very little deviation in my jaw. Compare that with this second demonstration. What you'll notice there is my jaw deviated. The lines between the front of my teeth, they didn't stay straight all the way down. My jaw moved out and came back in. This is representing a dysfunction in our jaw. So now that we've done 1 rep of this exercise, we've demonstrated whether our jaw stays straight on the way down and up, or if our jaw moves side to side on the way down and back up. Whether your jaw moves straight on the way down and up, or if it moves side to side, you still want to do this exercise to help with your jaw pain. And the exercise is exactly what we did on the first rep, but we're going to do it 10 times. What we're going to focus on is we're going to try our hardest to keep the line between our front 2 teeth perfectly straight on the way down and all the way back up. For example, something to help with this is counting 4 seconds on the way down and 4 seconds on the way up. We want to do this nice and slow because we're retraining of movement to become the proper movement. We have a dysfunction, it's not working properly, we're trying to retrain it to work correctly. So down 4 seconds, up 4 seconds. That's 1 rep. We want to do that 10 times. And we're going to do it after we brush our teeth in the morning and after we brush our teeth before we go to bed. We want to do this every day for that first week. What you will notice is day after day, you will get progressively better. This exercise will get much easier and your jaw will become more aligned. To summarize, everyone, jaw pain sucks. But the good news is we don't have to suffer through it. The technique and the exercise I showed everyone in this video today will go a long way to reducing your jaw pain. If everyone can comment below and tell me how their pain has changed after trying this technique and the exercise, I would really appreciate it. Please like this video, please subscribe, and leave a comment below. Thanks everyone for watching.